Hi, is anybody there? Hello?
Hello.
Hi, this is Dr. Deb Fleming.
Welcome.
Hi, Jenny.
Hi, Heidi.
Can you hear me?
Yes.
I can hear you.
Wonderful.
You are.
Does it work?
No, it works fine, thanks.
I can't join, it's telling me my meeting code is invalid.
Are you using the new one? There was a new one that was sent.
I used the one that Amy had in the agenda, it's a different one.
It's a different. Are you going to share your screen too? Or do you want to share?
Hey, Jason.
Hello.
I'm just giving people a few more minutes. It's at 4:30. Mark. Do we have board members who are connecting by a cell phone? If you are on a cell phone, are you a board member? Jenny, had you received any information that board members might be late or not available by
I
any
did
chance?
not hear from Mr. Lynn or Emily.
Okay,
Is it possible that they didn't get the change yet?
They may need to check their mail to see the change in the Zoom link. There's Michelle.
Hey, Michelle.
hi, Michelle. Hey,
Hi,
Jen.
everybody.
Hello.
We need one more. No, actually, we have a quorum, so we can go ahead and proceed. So why don't we do that? I have texted the other board members just in case they were using the wrong link for the meeting. So let's call the meeting to order at 4:32. Thank you, everybody, for joining us on this sunny afternoon. It's a gorgeous day outside. For the roll call, I will call out the board members' names, and you will designate as here to let Jenny Parcell is going to be taking the minutes today. And then for those who are guests and wish to speak during the public comment, please sign up in the chat with your full name and your address. And then at that time, I will be able to call off in the order in which people show up in the chat. Okay? And there's Emily as well. Okay, so let me take a roll call. Jason Marker,
Here.
John Lynn,
Here.
Ilana Kirsch, Emily Dean,
Here.
Michelle Migliori,
Here.
and Amy Murray. And I'll recall Ilana Kirsch.
Hi.
Hi. Awesome. Okay, so we've just got Amy, which I'm expecting her to be joining us, but we may then go ahead and proceed. And as a reminder, if you are a guest and you wish to give comment during the public comment section, please sign up in the chat with your full name and your address. And then I will call you in the order in which you appear in the chat. So let's move to adoption of the agenda. And before we proceed with that, I have an agenda item that I would like to add under new business for the discussion of the Department of Health strategic plan. So it is recommended the Board of Health members adopt the agenda for the September 16, 2020. May I have a motion?
So moved.
So moved.
And a second.
Second.
Thank you. Any discussion? All those in favor, say aye.
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 Aye. All those opposed? The ayes have it. We have adopted our agenda with the addition of the discussion of the department's strategic plan under new business. Let's move to item number 3, approval of the minutes. It's recommended the Board of Health members approve the minutes of July 15, 2020. May I have a motion?
So moved.
A second?
Second.
Any discussion?
Heidi, there was the matter of minutes from where Mary Beth was Spalding was noted to have made a comment, but that was an error back in May. And Dave Keckley had suggested that at this time during the approval of the minutes, and Dave, by the way, cannot make it because of illness in a family. Suggested that we also at this time talk about or at least insert the note that those minutes need to be corrected, and that he will look into it.
Okay, that is fine. Duly noted. Any other discussion on the meeting minutes? So then let's vote. All those in favor say aye.
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 All those opposed?
Yeah, this is it.
The ayes have it. We've approved the minutes from July 15th. For board president announcements, I have just one, and that is to announce that Amy Murray is going to be resigning from the board. Although Amy has only been with us for a really short while, she's been an active member and she's really been engaged in the development of our strategic plan as well as the department's strategic plan. She is pursuing a new position in California, and I want to publicly thank her for her service and that we wish her all the best in California. So, I know, right? So next, moving on to number 5 is the health officer's presentation and report. So I will turn it over to Bob Einters.
Hey, thanks, Heidi. The board should have received the report from the month of July and August, so you should have that. I really don't have anything to point out that's particularly remarkable in those 2 reports. It's pretty much business as usual. There is one area, though, that really is pertinent to what's happening right now that I do want to make you aware of, and that is our mosquito surveillance for particularly West Nile and Eastern equine encephalitis. You probably have heard that there was a case in a human of Eastern equine encephalitis, if I can, I'll just call that triple E, in LaPorte County. You may recall better than I, since I wasn't living here last year, that there was a pretty significant uptick of triple E in the Michiana area. There were upwards of just short of 20 cases, I believe, in humans last year. And this is particularly concerning for our area that we have a case now. And it's, though we've not found any triple E so far within St. Joe County, I would say that the likelihood that we will find one is reasonably high. So we'll continue to look for that. Brett Davidson, our environmental health unit, has done a fantastic job revving up, restarting a surveillance program that had been relatively moribund the last couple of years. And they're working hard to look for this virus. If it is found, it's most likely going to be found in swampy bog areas, so Chain of Lakes, the Leidig Bog, etc., are areas that we're particularly concerned about, and of course have distributed information. ISDH has sent information out about protection and prevention. So that's the one thing that I just would like to highlight on the report. Otherwise, you'll hear from Vital Records in the new business portion. You'll hear from Erica about Vital Records, but otherwise I'm happy to answer any questions that anyone has about the 2-month report.
I think I'll go ahead and then ask a question. Bob, in our conversation, we had talked about that, 2 months ago, the board passed a resolution declaring racism as a public health crisis. And in the conversation that you and I had, there was some initiatives that were new for the department. And would you be so kind as to share with the board some of those things that you guys are doing?
Yeah, we've done a number of different things just over the last month or two to address this issue. We've got plans to begin implicit bias training within the St. Joe County Department of Health. We have hired a couple of new individuals, both minority, if you would, people of color, individuals of color. We are working on hiring community health workers from particularly the Latino and Black communities on the near west side. We have started and are funding of using CARES dollars, the testing sites at St. Adalbert's and WUBS, again, focusing on communities of color and doing what we can to ensure that testing is available for those communities. As everyone is, I'm sure, well aware, there has been pretty significant disproportionate incidence of COVID within those two communities. And more recently as well, working with our partners in the city and in the county and embracing, responding to the problem of homelessness, which again is a unfortunate manifestation of racial inequity and structural racism. So we'll be working with our partners to respond to that. Those are some of the things that we have been doing. Happy to again answer any questions that you might have about that.
You know, to add to this part of the discussion, the board members and I are also looking into the implicit bias training. Many people on the board have already engaged in some components of that. So we expect to continue that conversation and keep moving forward on that. And then as we look to make recommendation for Amy Murray's replacement, we will also bear in mind that we're thinking about the racial and ethnic composition of our board and in that selection. So I just wanted to add to that as well.
I'd like to commend Bob and the health department generally for all of those steps that you've already taken on. We just started this initiative and it's refreshing to see how much you've been moving forward with this. So thank you for that on behalf of the board, really.
And I left one out that I should have mentioned as well. Thank you for those comments, Ilana. But we also met with OCON and a representative from the police department looking at ways that perhaps the health department could be more engaged in crisis intervention. Again, not sure what will come of that, but certainly investigating that and looking at ways that certainly for non-criminal phone calls to 911 dispatch we might integrate in some way with them and effect a different response than what has been happening over the last several years, again, for non-criminal calls.
Maybe something similar to that article that I sent to the board some months ago about what's being done. I think it was somewhere in Oregon or Washington.
Well, you may be referring to Cahoots. There is a program in Oregon, Cahoots, and so this would be very similar to
That's
that.
a great program.
So Oakland is very enthusiastic. I think all of us are I know all of us are very enthusiastic. We'll see about doing some sort of a pilot program. No promises, but we're certainly exploring the possibility.
Thank you.
Would that type of program require new like personnel and staffing, or is it something that could kind of be launched with who's in the health department now?
Well, in fact, one of our new hires is a social worker, and it is the very first social worker that we have had within the department. It's very deliberate in hiring a social worker. That hire is focused in part on lead, but again, it's that sort of training and expertise and passion that will be very helpful for us, Emily, as we try to address inequities and disparities in areas beyond lead. So yes,
Great.
We will. And, again, funding's always an issue, but one hopes that with the right ideas and the correct vision, the funding will follow.
And that kind of leads me to my next question. I know as this is all kind of rolled out, there has been a lag or kind of a slowdown in lead testing and immunizations because people have been kind of staying close to home and everything. How is that looking? And, as the fall is rolling out, I know school has already started in a way. But how has that kind of rolled out for the department? Have there been any upticks or?
I wish I could say that things were getting significantly better. In part, I can say they are, certainly not in July and August, but here in September, as it relates to immunizations, we're just now within the last week beginning to implement some programs with the school systems again. With lead testing, bringing on the social worker, bringing on the community health workers, and as all of us get a little bit more comfortable with wearing masks, physical distancing, yet still getting our work done, I remain hopeful that we'll begin to see more progress there. But admittedly, it's still much slower than any of us would want. And I think all of us share the fear that with the kids having been inside over the last several months more than perhaps they should or would have been if they had been in school, that the exposure has been greater. So far, we've not seen that, not discovered that, but that remains to be seen.
Yeah, I share that concern and that fear. And also,
Emily, if I can jump in there real quick, our lead testing is down, this year compared to last year, although given the duration of the pandemic now stretching on 6 months, it's actually not down as far as we feared it might be. But clearly the evidence suggests that the proportion of elevated lab values is no higher than what we've seen in the past. So that may still accumulate over time, I guess, is the risk, but to this point, we certainly have not seen any increase.
Are there any other questions from the board members for Bob? All right, awesome. Thanks, Bob. Why don't we move to the next agenda item and turn that over to Mark?
You all should have a written report actually that was prepared for last month's meeting. Much of the content is very similar. Our focus over the last several months has been on return to school, both for area higher ed institutions as well as K through 12 schools. Bob alluded to the testing sites that have been set up at St. Adalbert's and at WUBS. We're working to get additional expanded testing with some grant money from the state that would in particular extend evening and weekend hours for testing. We still have gaps there that testing availability drops on the weekends. So this, we hope will help shore that up a bit. I think a couple comments related to schools. We put out guidance on K through 12 schools in late July, and school districts have been responsive to that. In the interval since then, the governor put out metrics that are similar but somewhat more generous in their cut points and what they allow. Just in the last several weeks, and there's a new report on the state dashboard that summarizes those county metrics every Wednesday. So that just came out, got updated today. And then just yesterday, the CDC put out their metrics, their indicators for school reopening. So, I think they're about 2 months late and $1 or $2 short, but, fortunately, so I'm proud of the fact that the department put out guidance for area schools, given the silence coming from the state and federal level. Our metrics are pretty similar in the elements that we're looking at to the guidance that came out from the CDC. I think there's a little bit of variability there, but I'm proud of the department that I feel like we kind of stuck our neck out there just because there wasn't much to go on, but our guidance is consistent in terms of the elements that we're having the school boards consider. They're very similar to what the CDC has recommended even at this late date. So we've had ongoing discussions with the schools. Certainly the spike in cases at Notre Dame through our county metrics kind of through the roof for a while. The impact of that has largely washed out of our metrics. And actually Heidi is a faculty member there. I don't know what your perspective is, but the university has done all the things that we wish that cities and states and countries would do in terms of ramping up diagnostic testing, implementing surveillance testing, having timely contact tracing, adequate isolation and quarantine facilities, and pretty stringent mitigation strategies in effect. And so implementing all those things, they took what was a pretty, concerning situation with 100 cases a day for 3 consecutive days, or nearly 100 cases a day for 3 consecutive days, 3.5 weeks or so ago, now to having a handful of cases a day, and surveillance testing that's well under 1% with pretty robust testing in place, both diagnostic testing and surveillance testing. So I think it demonstrates in microcosm what is possible, and that's actually encouraging, and would love to see that expanded and replicated. So I'll stop there, but would be happy to take any questions or comments on that.
Could I piggyback, Mark, on your report a little bit and
Sure.
talk about the inspection and ordinance?
Yep.
So as you all know, our environmental and food teams have been doing inspections on a regular basis, and including inspections from 11 at night to 2 o'clock in the morning. What we're finding during most times, there's pretty good adherence, and these are inspections of bars, restaurants, nightclubs. Pretty good adherence during the day, but unfortunately, particularly later at night, and particularly this last weekend, which was a football weekend, as you all know, the adherence was abysmally poor at the establishments. So this is adherence, unfortunately, by both individuals and to a degree, the employees, so customers and employees. Not universal, but much worse than what we had been seeing. So we have made the decision to amend the ordinance. At this point, we're withdrawing from the ordinance the request to empower the Department of Health to fine individuals, but we will keep the request to empower the department to issue citations and fine businesses. In addition, we are redoubling efforts to shine a spotlight on those establishments that are doing a good job of adherence, and we're looking at ways to notify the public of establishments that are doing a particularly poor job of adherence to the order. So Mark and I will be happy to take any questions on any of that.
Was that activity over the weekend on the part of the department, was that based on complaints or just a hunch that it might be a good time to go out and do some observing?
It was a little bit of both. Yeah, a little bit of both. It was at the request of elected officials, that I can tell you.
Oh, okay.
So I take that as a complaint. It was a complaint. It was a complaint by a number of elected officials that this was probably happening, and they wanted some verification.
Mm-hmm. All right, thanks.
Do we have any other questions for Mark around COVID? Okay, so let's go on to new business. And as part of when we adopted the agenda, we added the discussion of the department's strategic plan, and the board members, of course, have received that. And Bob, if I could just turn that part over to you so you could give us a high level of this document that the department has put together.
Oh, okay. Yeah, and so you should all have received a draft of the St. Joseph County Department of Health strategic plan. And admittedly, this is aspirational, but that said, I think it is within the realm of possibility that what we have put down here is in fact doable. These are activities and outcomes that I think we can achieve and make a fairly significant impact on the health of the county. And again, I'll just go very high level. You all have seen it. I've received feedback from a number of you. Just starting here with goal number 1, it's clear that we need a much stronger information system in order to collect the data, to analyze the data, to monitor and evaluate the programs that we choose to implement, for that matter, programs that we are implementing, and activities and programs that we will implement. So all of goal 1 relates to that. And in certain ways, the COVID epidemic has provided a little bit of silver lining in that some of the dollars that we were awarded, the county was awarded for CARES, or from the CARES Act to address COVID, are being used to help us develop a little bit more robust information system. COVID cuts across virtually every unit in our department: foods, environmental, vital records, nursing, hope, HEED, etc. And so in that sense, we are able to use those dollars to target the information needs of all of those units. Goal number 2, and again, I'm not going to take the time to go through each of the objectives here. This document has been fairly widely distributed, and anybody who, or any of, no problems at all, no reservations at all, unless you all do, making it more widely available. Goal number 2 is developing the health equity epidemiology and data unit and all that goes with it. Here again, I'm not going to go through the objectives, but certainly looking to Cassie White and her leadership of this new unit, and particularly in partnership with Robin Vita and the Hope unit, to make some significant impact here within the county. Goal number 3, St. Joseph County Department of Health will address social factors impacting health, most notably poverty, racism, trauma, and here we're specifically trying to engage more in adverse childhood experiences. There are a number of not-for-profits and other entities, establishments that are in this space already, but it's a relatively uncoordinated space. And it's a space that begs for evidence-based prevention of adverse childhood experiences, and not only managing matters of resiliency and delivering trauma-informed care to individuals who experience these adverse childhood experiences. So we'll move forward there. And then lastly, I shouldn't say lastly, goal number 4, obviously we have the statutory requirements that everybody thinks of when they think of Department of Health. And we have a number of initiatives planned to increase the effectiveness and efficiency of those units dealing with those statutory requirements. And then lastly, but not necessarily least important is the efforts that we need to implement to control the spread of respiratory viral illnesses such as SARS-CoV-2 and influenza. And we've created plans to address, of course, those problems. So it's a fairly, depending on one's perspective, a fairly detailed document. It's 10 pages long, yet could also have gone to 110 pages. But it's there, and I just thought it would be good at this meeting to share it with the board and see if there's any concerns that you might have at this point about it. It's still in draft form.
Yeah, do any of the board members, do you have questions? Yeah, Jason.
I'm curious, between the first draft of this and the present draft of this, what sort of input did you get from the rank and file employees there within the department that manipulated, molded it, changed it into what it is today, that you were able to show some responsiveness to their boots on the ground sense of what the community could use?
The first draft was in fact what I reached out to them for the very first draft. And so that very first draft reflected their input, and subsequent to that, they have received it, but really not much more from them. I mean, some tweaking here and there from some of the directors, but mostly what they had submitted to me in when I was preparing the first draft was contained. Either that or they're just being real quiet and not telling me.
Well, I don't think it's probably that, but I appreciate their robust input into this plan. That's great. Thank you.
Bob, I was wondering, like, who in the community has had an opportunity to review this and provide input?
Individuals within the community have, and I have shared it with some individuals putting it together. Of course, I met with many members of the community, and their input is reflected in this, but I have somebody.
Bob, can you hold on just a moment? Somebody has just joined by iPhone. Could you put your phone on silent, mute?
Can I see it?
Jenny, can you, oh, there we go. Bob, please continue.
Yeah. So I really wanted, before I shared it broadly, I thought that input from the board was important, and not that I'm asking for sign off on a draft, but certainly looking for quasi sign off on the draft. The next step then would be to share it. Again, it's not been a secret. Anyone who I've talked freely about this strategic plan and have mentioned it on a number of occasions to individuals within the media, but no one has asked me for it, or if they have, I forgot.
Well, I, for one, I want to thank you for initiating this and getting us to this point during COVID time. You have been pulled in 10,000, you and your whole team, the whole department has been pulled in so many different directions. And to get a document as detailed and comprehensive as this is really commendable. I'm teeming with excitement, and I'm thrilled that we have a comprehensive plan like this. It's a real success for the department and your team, Bob. Really.
I appreciate that. The team, the directors played a huge role in putting this together. My own personal feeling is that I'm never comfortable trumpeting what we say we will do. I'm much more of the mind that we need to roll our sleeves up and get our hands dirty, even more than what we have done. And if we are successful in certain areas, then it's time to trumpet it. But I do appreciate that we have some remarkable leadership in the various units of the Department of Health. I have great confidence. Clearly, we'll be looking for help from the board and for the influence that you have within the community. We will not be able to do this without your help and your input. And quite frankly, we're going to need the input and the help of a number of individuals, leaders in the community, as well as everyday citizens.
Great. John, you had a...
Yeah, Bob, I just want to echo Heidi's remarks. I love the document. I love the detailed nature of it. I love the part about, developing our staff and supporting them. I think it's ambitious. I love the bold nature of it. I think it's exactly what, at least I've been craving since I've been on the board. I think it gives me, as a board member, some insights as to what I can do to help the Department of Health. I've been a little lost in that over the last, well, really since I've started. So I love it. Implementation, I think, is going to be challenging, but they always are. And how it's going to be monitored and will be a good challenge for you and for us too. But I look forward to it. I'm excited.
Thank you, John.
I will third that. I don't mean to, but I was just so optimistic reading this. And as I was reading through it, it made me think that this sounds to me like the kind of ideal health department you would want in any community where you live. And I especially appreciate goals 2 and 3. And your emphasis on kind of being a leader in creating a trauma-informed community, so that isn't the responsibility of one small part of our city and county system, but kind of we all can play a role in supporting each other in all of the different challenges we've faced through our lives. I just think that's amazing, and could just create a really wonderful foundation for community building. Which could really go a long way in improving the health of everyone. So I'm just really, really excited.
Well, we have some interference. There's somebody on the call at 298-899255. Could you put your phone on mute or silent? There's somebody.
I just did. I'm sorry.
Okay.
It's Dr. Deb Fleming. I'm sorry.
Okay. Thanks. Thank you. Okay. So where were we? We were talking about the strategic plan for the Department of Health. Does anybody else have any comments from the board? If not, then we can move on to our next agenda item. So I'm flipping between screens here. Okay, so the next item that's up is for the Board of Health role and responsibilities. Let me pull that one up. So the purpose of this document, for Bob and Mark and for the department employees, we wanted to make more transparent the roles and responsibilities of each of us who serve on the Board of Health. Of course, we have documented roles and responsibilities per the Indiana Code and the Indiana Association of Local Boards of Health, for sure, which we will adhere to. But there were a few other things that the board, that we felt like we could be more transparent about and agree to, that these were the roles and responsibilities. These are the things that we want to live up to. And so we added a few items, and well, you know what? I'll just take a moment to read them because it's very quick. But we agree that we want to regularly attend scheduled meetings. We attend scheduled assigned committee meetings. We commit to pre-reading materials so that we can have a quality discussion. We want to support the work of the department in the areas of their individual expertise when we are asked. We want to be a strong, positive advocate of the Board of Health agenda in public and private venues within our sphere of influence. We want to adhere to board consensus if we have controversial matters. Inform the board president and/or the vice president prior to any media engagement that may have a bearing on the Board of Health. And then finally, assistance in identifying members for committee roles throughout the department or as needed for Board of Health projects. So again, this is our way of being transparent to the folks that we are working with here at the department. And so we are taking this time to present this and to just have a brief discussion, and then we'll take a vote to approve and adopt this document as the roles and responsibilities for board members of this Department of Health. So I will open it up to any kind of discussion from our board members.
I'd say I agree with everything you said. I don't think anything you proposed is controversial for our role as board members.
Thanks, Alana.
I think this is a nice opportunity to have this out there. We've done the document about our stance on racism and its constructs within our community. We have 2 strategic plans, the board and department strategic plans. This is a great opportunity, I think, here in the 3rd quarter of 2020 to kind of get these documents in a good shape, a workable shape, so that as we head through the first stage of COVID and into what comes next, managing it in the context of the rest of the public health things that we managed, we've got strong footing for how we responsibly attend to all the things that are required of us at this time. Great work.
Yeah, nicely said, Jason. Thank you. I would add to that and to John's earlier comment about we've sort of been waiting for this structure. We've been waiting for the strategic plans, and this is now our opportunity to put these structural documents in plan and making them transparent to not only ourselves as a board and holding ourselves accountable as a board, but also so our health officer and our department employees also see what we are committed to and what our goals and our intentions are. And of course, we'll be talking about our strategic plan in just a moment. So if that wraps up the discussion, then may I have a motion to accept this document?
So moved.
Second?
Second.
Thank you, John, for the second. All those in favor, say aye.
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 Any opposed, say nay. The ayes have it, so we have adopted that, the roles and responsibilities for the Board of Health. So next on the new business item is an update on the budget for 2021. Amy, are you on the call? I think you are.
Yes, hello. Actually, we don't have an update at this time. The budget is going to be heard at the council committee meeting on Tuesday, September 22nd, and then it'll be presented at their October, I believe, 13th meeting for a public hearing and final vote.
Oh, okay. So our next meeting is on, I have October 21st. So at our next meeting, we'll have an update then. We'll know.
Correct, to know if it was approved as revised and submitted, yes.
Okay, great. That's awesome. Thanks for that update, Amy. I appreciate
You're welcome.
it. So the next item, looking forward to this, the unit spotlight. Our department head, Erica, is going to give us a presentation on vital records.
Hello, can you hear me?
Hi. Yes, we can.
Okay.
Perfect. Doctor suggested that I give a brief rundown of our day-to-day because a lot of the board members are new and don't really know that there's more to vital records than just issuing birth and death certificates. So the first thing is just a general timeline of how ancient our records were. I've been here for 20 years, and when I started, we were on typewriters. We gradually progressed to PCs. So everything that we have between 1882 and 2004 literally was on paper in a book somewhere like that. Also, between 55 and 2004, we went to microfilm, and then we will be completely digitized by the end of this year, which is amazing. And we can honestly thank COVID for that. But there's a hefty price tag on that. But our records are on ledgers. Again, thousands and thousands of records are in ledgers and books. 1962 is when they started to get typed. 55 to 2004, they went onto microfilm, and then again, we started going on to PCs, and the hospitals and the state became digital in that aspect with connecting with the local health departments, which would be us. So that is just a general timeline of what we have in terms of records and how we keep them here, and that boils down to how we issue, store, and record and everything. So I wanted to say that I'm grateful that finally this year we are fully staffed again. We were without our 5th person, which means we had our Mishawaka closed for about 5 years. Mishawaka office was closed for about 5 years. So in this year's budget, we were approved for our 5th registrar to come back. We reopened Mishawaka, which was a godsend until COVID came, and we had to close our doors, obviously. Our 5th hire is bilingual in Spanish. She does speak Spanish, which also is amazing and much needed because we do have a lot of bilingual customers and a large bilingual community, obviously. There you will see just a rundown of our team. Angie is still cross-training in all of the areas. It does take a long time for somebody to be fully secured and learning how to do everything. Her main duty, though, will be to do the birth portion of vital records. Again, there you see our 2nd location in Mishawaka. The convenience of that is that it is on a 1st floor. There is secured parking there, so somebody doesn't have to look for parking on the street, so tell all your friends. We are currently using that as our walk-in office just to kind of monitor traffic control. We have our funeral directors coming into the South Bend office. We have anybody that does show up into our South Bend office come up. We will help them, and we are taking our appointments for paternity affidavits, correction affidavits, things like that take more than 10 minutes to serve. We are taking those appointments here, but we are redirecting walk-in traffic to the Mishawaka office. There you see what services we do provide in this office. Obviously, birth and death certificates, but we also established paternity, which kind of shocks a lot of people. You think paternity and automatically think DNA testing, but by definition, paternity is just a father that's named on a birth certificate. There are several ways to get to that point. It can be done in a hospital within the first 72 hours by signing an affidavit between the parents. After that 72 hours, it can be done in our vital records office up into the legal age of emancipation, which is currently 19 in Indiana. And then it can be done via court order, which means the judge orders paternity to be established and names a father on a birth certificate. So we also do paternity by marriage, which is legitimation, and there is a marriage certificate involved there. Some people either are adding dad or they're adding the marriage certificate, making the record into a legitimate status, meaning that mom and dad want to be presented as Mr. and Mrs. So that there is a $75 fee for. That is an in-person appointment. You have to do that in our office. The reason why is because we do an explanation to both parents of what they are signing, and unfortunately, if they are not present, we can't verify that they understand what they are doing, and it could be compromised. We also do correction affidavits. Last year, the state actually was a little bit more lenient on some of the things that they allowed to be corrected on a birth certificate, but they also became a little more strict, and that's due to the Real ID that's happening across the country. Minor changes can be done with a correction affidavit for a fee, spellings to names, things like that. There are several things that cannot be corrected and require court orders, which are the sex of a person, male or female, the year a person was born, and also the surnames of everybody involved, child and parents. Those three things do have to go to court, and they must be court ordered for us to change the birth certificate. You see there the adding the same-sex spouse. Indiana passed a law that went through. Currently, the system that is used by the state Genesis does not allow the hospitals to add 2 same-sex parents to the record. So what happens is the child is born with the laboring mother put onto the record, and then they come in here and we do an affidavit to add the spouse to the record. The new system that is coming, which you'll see on another slide, Drive, will allow the same-sex parents to both be added at the time of birth, and will eliminate that extra step for the parents to come in here to have the second parent added to the birth certificate. We also do genealogy, which has picked up since a lot of people were sitting at home with nothing to do. Basically, people want to know their family history, get a medical history, why people died, things like that. Sometimes it could be a lot of work, but again, being that we are going to be completely digitized, it will make everything a lot easier, a lot faster, a lot more convenient for everybody involved. And then we offer notaries. We see a lot of notaries, just people sending everybody up here because they know that we are notaries, and those documents that I mentioned earlier, the paternities and the correction affidavits, all do have to be notarized. Next, just a few updates to what we have going on. The biggest project, the main project, would be the completed digitizing of the birth and death records. It is a long process, and I am so glad I'm not one of those people that are doing that, because it's a lot of work. Second, I just gave a little bit of the hit that we took in Vital Records, just Vital Records, during those COVID months that we were closed. A 40,000 plus difference just in what we took in this office due to COVID. We actually went live, I think the day the county actually closed the doors to the public, online to taking applications for birth and death certificates, which was great. It took a little while for the word to get out, but once it did, it really took off. When I did this presentation a month ago, at that time, there was over 1,600 applications completed online through the county's website, which is amazing. And then you also see the Drive that is replacing Genesis, which is not just a big deal for Vital Records, but we also interact with our other departments for statistical reasons. We don't have access to get statistical reports the way we should, and this new system is supposed to supply us with that on a much quicker and a much more detailed reporting process. So I went to a 4-hour Zoom training, and I got about 25% of what I needed to get, just because we were short-staffed here, but I will be going back to another one in October. But it looks promising. I'm grateful nonetheless, but we shall see what happens with that. Next, just a few goals that we have. Obviously, we want to become more mobile in the community. To be honest with you, I think I get recognized a lot in the community. I've been here a really long time, but a lot of people ask us a lot of questions about other things that they know the health department does. But we have never been present in the community during functions and events that other departments, particularly HOPE and departments like that, participate in. And I would love to show up there and make it a one-stop shop for a lot of parents. You know, a lot of parents don't realize they need a birth certificate until it's last minute, which becomes inconvenient. And just to be able to say, hey, you can get this here, one, it makes them think whether or not they're going to need it. Two, they can discover if there's work that needs to be done on their record. It just makes, our goal is to just be more convenient in the community and present. Second, it would be great to have training for my staff. Our team, though we keep up with the times just because it's presented to us, like if we could have, you know, just training. And the last time I was trained in Excel was probably like 15 years ago, to be honest with you. PowerPoint too. So just to be able to be fresh on what's coming our way, just to be able to give back, you know, the best that we can, and whether it's in a spreadsheet or a presentation similar to this, whatever. Finally, a personal goal would be to host the IBRA Fall Conference, which is the Indiana Vital Records Association. St. Joe County, being one of the largest counties, has never hosted this. With Dr. Bob on board, I think it's the perfect time and opportunity to throw St. Joe into the pool of counties. And with the new casino here, I just think there's a lot to offer in St. Joe County. So I'm hoping, I wanted it to be 2021, but that's definitely not going to happen because of COVID. So I'm shooting for 2022. I'm just, fingers are crossed that we can do it. I think it's going to be great. I think that we have a lot to offer in showing other counties what we do here. We are actually one of the counties that get called a lot to say, hey, what do you guys do when this happens? You know, what policies are you using for this? So they do rely on our county a lot, especially our neighboring counties. So I think that it would just be great to finally show them how we do things here. Any questions?
Erica, that was great. This is Jason Marker. I really appreciate all that information. As we've got all these records now digitized, is there going to be a move for some of the older records to be available sort of by self-service? If a person is looking for a particular record, wants to print off an old death certificate from a grandparent or something, will some of that be further automated in the future?
Birth certificates, I can definitely say no. Death certificates, that's not something that we've talked about. I do believe that the Indiana State Department of Health does have an online service with Ancestry.com, honestly, that you can access records. Whether or not they're as current as ours, I do not know. But that's not something that we're equipped to do, for one. But it's definitely a conversation that we can have. But yeah.
Thank you.
Erica, I have a question.
Sure.
First of all, that was a really nice presentation, so thank you for that. My question is, now that you are nearly having everything digitized, and by the end of the year should have everything digitized, what are you doing with all those millions of pieces of paper? And can they be shredded so that we don't have to have so much storage?
So in 2004, we brought a software on called DocuWare, which has become our digital filing cabinet. So every piece of paper that comes through this office, even now, is scanned and stored in a digital filing cabinet within DocuWare. Prior to that, those years between 55 and 2004 are on microfilm. Prior to that, it's in a book, and our vault is in office. We have been talking about moving those into a temperatured secured storage eventually, if possible. It just depends on how confident we are in the indexing that's being done. We do go to our books a lot and into our microfilm just to confirm things, whether it's a typo here at the local level or something at the state level. We do go back into the original record to verify information. We have not gotten the first batch of the indexed product yet, so I am excited to see what it looks like. But yes, I'm sure Amy will agree. Her goal and my goal would be to get all of our books contained somewhere else other than the office, because it would free up some space.
But please don't shred them. The historian
No,
in me.
it's against the law. We honestly cannot
I was
shred
gonna
them.
say, the historian in me.
Absolutely.
I just was like, I cringed. Oh God.
No, we cannot.
Don't do that.
Emily, I was thinking the exact same thing. All of those ledgers being destroyed, all that handwriting. Oh no, right, exactly.
I have nightmares about that handwriting, Heidi.
You do. You start to see, but it all starts to make sense, which is amazing. You can read
Yes.
it really easily.
Yes.
Yeah.
And we would be able to work from home. That is the biggest thing, is if we had to shut down again during a pandemic, we would be able to serve the public still 100% working from home once that happens.
Yeah. Erica, that was a terrific presentation, and
Thank you.
we so appreciate your leadership on this, getting us to this place of digitizing all of our records. And I love this idea about becoming more mobile, you know, that folks don't have to come up to the floor, that perhaps there's going to be opportunities in the future when people are going to be able to interact with you directly in the community at events or otherwise.
Yes.
So love where you guys are headed and what you're thinking. So awesome job.
Thank you.
Yeah, absolutely. Anything else for Erica from our team? Yeah, nice job.
Thank you.
Awesome. Okay, let's see where we are on our agenda. So now we are into old business, and we're going to talk a moment about harm reduction strategies. Jason, can I turn that one over to you?
Sure thing. Last February, we were just sort of engaging in a conversation about wanting to talk with some of our partners in area regional health departments about harm reduction strategies for opioid use disorder. And that was short-circuited in February and March. And just recently, I've had some communication with Erica Chapman, the Indiana Department of Health Harm Reduction Program Manager. She's been doing some work in other parts of the state related to harm reduction strategies. And she's asked whether that's ready to be back on our docket again. And so we've had some conversations with some other community players around opioid use disorder and harm reduction strategies. And I think it's time to do that. I just thought since this had not been on our agenda for a while, I would bring that back around to make sure that I still had everyone's approval to sort of engage in some of those meetings that happen outside of the regular Board of Health time and then report back how that goes. I think we'll start with probably some local conversations about just what St. Joseph County can be doing around harm reduction strategies for opioid use disorder, and then be back to engaging with Region 2 partners who are compelled to want to have that conversation with us. So there's been some interest at the health department, state health department level to do this in a more regional model than in a county by county model for some of these things that are sometimes a bit more controversial. And so I thought just to stay above board with all that, I would bring it back up and make sure I still had your all's approval to engage in some of those conversations and report back in the future.
Yeah, awesome. I'm glad that you're still interested in it and willing to still champion this. I would add, Jason, I don't think I'd shared this yet with you, that I participated in a District 2 continuum of care meeting for HIV, and CDC has a new initiative to eliminate HIV transmission and hepatitis C. So this might be just the right time now to engage or bring whatever working group that there is that's working on this, and bringing it together with the working group that's going to be looking specifically at HIV and hepatitis C. This might be just the right time now.
I think a lot of forward thinkers in this area are pulling all that into one thing. I mean, that's been a little bit siloed for a long time, really maybe for a couple of decades. HIV, hepatitis C, opioid use disorder, safe syringe programming, and other harm reduction strategies. And now seems like the right time. I think what we've seen some statistics around what has happened in those silos during COVID-19, small upticks in HIV, larger upticks in hepatitis C, some major spiraling downward of the control that we had over opioid use disorder. Now is probably a good time to bring those under one umbrella and say, what are the strategies to help all of these in one fell swoop?
That's a really terrific recommendation. ISDH is they're contracting with a community organization they're basically like on a listening tour. They're going to every district in the state of Indiana, and they're gathering this kind of information. What have been the barriers to care? What are we not doing right? What are we doing right? Yeah. You know, and of course, what was still coming through loud and clear is that we don't have enough providers to serve the HIV community. We don't have enough HIV testing sites. It's not readily available. And that goes the same for STD, and not enough mental health providers.
Yeah.
And of course, the large overriding one is the stigma that is still associated with HIV and STDs.
John Horsley from one of the VPs over at Oaklawn and I have been spearheading this with Erica, and absolutely these are the conversations that people want to have right now to break down some of those barriers and get everybody back on the same page.
Great. You know what I'm going to do is I will email, because I had a conversation with the person who was at that community organization, the one that they're consulting with, and I'm going to I'll connect you by email. Yeah,
Okay.
make
Yep,
sure that
that's great.
that
In fact,
all,
there's even been some insurance entrants. I've got a meeting set up in a couple weeks with, I can't remember the company that now has one of the big Indiana Medicaid contracts, but they specifically reached out to say, what are the barriers to some of these interventions in your neck of the woods? And they want to sit down, like as an insurance company, and say, how can we bring some dollars into your community to help break down these barriers? It's along the same sort of conversation. So yeah, email me that. That would be great. And then I'll give you all some feedback as some of these meetings happen.
okay. So my feedback to them, I mean, I already listed out a couple, but the other big picture item is just our overall public health infrastructure doesn't work all that well. And so hit on those, like the big idea kind of things, like the things that are statewide, the fact that we don't fund well STD prevention and treatment and those kinds of things. What are we doing about reproductive health education? How are we educating young people about their bodies? So it's those big items that we also make sure that we need to be touching on, as well as the things like having access to high quality care if you have HIV or hepatitis.
And there's two things I would say about that. One is, of course, as a primary care provider, that interface between primary care and public health, which has been so fractured for a few decades, is really growing. And this is a way to expand the human resources capacity of both of those two models of care delivery by partnering together to do that more efficiently. And I'd also say that I heard a really nice interview segment on WUBS here in town in the last couple of days, talking about every citizen's opportunity to vote coming up in the fall, opportunities to really be wise about who our elected officials will be relative to their stance on public health funding. And I think that's a good message for everybody to be thinking about and taking out to the streets as well.
Good point. Awesome. Well, I'm excited about this opportunity. I know like elimination campaigns and stuff, they can be costly and they're difficult. They're a lot of work, but it seems like the right time now. It just seems like the right time. So I'm really excited about it. All right, guys. Thank you, Jason.
Heidi, could I make a comment, please?
Yes, please. Go ahead.
I just wanted to re-emphasize what Jason had said, and also make sure there's not misinformation out there. It was brought to my attention by one of the unit directors that an individual fairly prominent in the community felt that your current health officer was not in favor of a needle exchange. It is true, if that individual had talked to me 22 decades ago, I in fact was not in favor of needle exchange. And I looked upon opioid use disorder in a very different light than what I have done over the last decade. There is no question in my mind, it is absolutely unequivocal that needle exchange saves lives and it saves taxpayer dollars. As you mentioned, reducing the incidence of hepatitis C, reducing the incidence of HIV. I can't tell you the number of patients that I cared for with infective endocarditis and the hundreds of thousands of dollars that we spent that could have been completely prevented through a robust needle exchange program coupled with other evidence-based harm reduction strategies. This is something that we should be doing, that we need to be doing as a community, and we need the community as a whole to come behind it. Saves money, it saves lives, and it does not, and this is where 20 years ago I was mistaken, it does not promote drug use.
Thank you. I appreciate those words very much, Bob. Really great. Thank you.
As do I. Thank you, Bob, for that. All right, let's go to our next agenda item, the Board of Health Strategic Plan. So similar to the roles and responsibility, I want to be able to present this plan and then ask for a motion to adopt and have an opportunity to have a bit of a discussion and then vote to adopt this plan. So a high-level review of the Board of Health Strategic Plan. So what we want to do is we wanted to execute a strategic plan that supports the St. Joseph County Health Department's goals and the work that our health officers and their team are doing. And so we developed 4 goals, and I won't go into the details of each of those goals because of course our board members have helped create this and so forth. But our 4 goals are advocacy, funding, partnerships, and of course, accountability. And so these are the things that, again, we're trying to make our desires to improve our Department of Health and improve the public health of our community. We're trying to make what we're committing to transparent here and in this document. And then those are the 4 goals that we want to commit to: advocacy, supporting our health department, funding, seeking funding where we can through either the normal course of what it is that we do or through extracurricular activities in our private lives, seeking out partnerships. Again, through the course of all of our work and in the community, there may be opportunities for us to help create partnerships for the Department of Health. And then of course, accountability, and that's 2-pronged. That's accountability for us as a Board of Health, holding each other accountable for the things that we say that we're going to do, and then holding our health officer and our Department of Health accountable for the things that they say that they're going to do. So if I may have a motion to put this before the board to have a discussion and a vote.
So moved.
And a second?
Second.
Wonderful, thank you both. So I'd like to open it up for discussion. If there are any comments or questions or changes, et cetera, I'd like to have that conversation now.
I think we've all had a chance to go over this document for the past few months, and I can say that I, for one, am very comfortable with how it has been put together, and so thank you for that, Heidi.
Thanks, Alana. Yeah, and just like with the other document that we've already adopted with the roles and responsibility, again, I see this as another document that we've all sort of been waiting for. What is our purpose here? Who are we as a Board of Health, and what are we working towards? And I feel like we're now getting these foundational documents into place, and then we can move forward. Also, what we've also discussed is that this is a document that will be a living document, that we'll review it every year and make sure that it stays relevant, and if we need to make changes, that we can do that too. So if there are no further discussion, then I think I'll just go ahead and call for a vote. So for all those in favor of adopting the strategic plan as presented, please say aye.
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 All those opposed? The ayes have it. We've adopted our strategic plan.
Thank you.
I'm so happy for us. This is awesome. Before we move into our public, am I at the right spot? Let me check my agenda. Hold on a moment. Board notifications, yes. So before we go into board notifications, I wanted to just acknowledge that Amy has joined us on the call. And Amy, earlier we were singing your praises and that we're sorry to see you go. And thank you so much for your contributions, but we're thrilled about your new adventure that you're embarking on.
Thank you. You know, it was a short time on the Board of Health, but it was a good steep learning curve. And I can tell you that I'm taking with you, or with me, Heidi, your leadership style, and I've learned from you, and I thank you for that, and from all of you. Really, it's been a very great experience. I'm going to a public health district in California, and that means that the board meetings like this are public. And so having had some experience with public board meetings, you know, it's just one more thing that added to my ability to take on the job, just, you know, one little piece of it. So thank you for the opportunity.
Awesome. Thanks, Amy. Appreciate it. All the luck, best of luck to you in the new position.
Thank you.
Okay, so let's go to board notifications, and we have a few. There have been a couple of hirings. So Notre Dame, in partnership with the Department of Health, have hired 3 public health fellows, Frank Spezia, Juan Esteban, and Mary Mumbai. And Frank has already started. He started on September 2nd. Oh my goodness, and Juan and Mary actually started today. So that's wonderful. These individuals will be with the department for at least 1 full year, and there's an opportunity to renew for 2 years. And it was a team effort in developing what the foci would be for this team, what they're going to be working on together, but they're going to be focused on ACEs, adverse childhood experiences, and health equity. So they've got tall order. They got lots of work to do because this is all new for us, and they are going to be reporting to Cassie. So they're going to be in the HEED department. And then we have not had any resignations, retirements, or terminations, but we have a promotion. Jessica Dilling has been promoted to environmental health specialist. So we welcome her to that position and congratulate her on her promotion. Okay, this is a time when we move into public comment. There's a 3-minute limit to the speaking, and I always have a paragraph that I read before we get started. At regular meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may only speak once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during open sessions of the Board of Health. The board president may interrupt, warn, or terminate a person's statement if the statement becomes personally directed, abusive, or obscene. All righty. So let me go to the chat box. And John Getz, you are first, and I will keep the timers so that at 3 minutes, if you haven't finished, then I'll let you know that the 3 minutes is up. So John, please go ahead.
Okay. Can you hear me okay? I have a...
Yes.
I would like to talk about the legality of a mask order. It says in the the county public orders that you are justifying the mask order utilizing Indiana Code 1620-1, excuse me, and 1641-9. I have read both of these codes, and I do not feel that there is anything in either that justifies or authorizes the county health department to issue any kind of mandate regarding the wearing of masks. In 1620-1-24 is the only section that seems to apply to epidemics. It defines epidemic control powers, and it only says that local health officers may order schools and churches closed and forbid public gatherings when considered necessary to prevent and stop epidemics. So that's the only thing in 1620-1. Now in 16-41-9, seems like you might have a better argument, but this section largely deals with whether or not you can quarantine an individual. And there are obviously exceptions to due process in cases of emergency. But there's, again, the only thing in here that has to do with masks is 1641-9-1.6, which says that you may instruct the public on the use of masks, gloves, disinfectant, and other means of reducing exposure to the disease. But it does not authorize you to order people to wear masks at all. I just wanted to request that the health department withdraw its mask order because it does not have the authority to issue it. Never mind the fact that your proposed ordinance would also violate several rights, including people's right to informed consent in medical care, as well as people's right to decline any kind of medical care, as well as people's right to freedom of expression, which are all denied by requiring the use of masks for all people. Thank you.
Thank you. Amy Drake, you are next. You have 3 minutes.
Hi, can you hear me?
Yes.
Okay. Well, I've spoke several times before you, and every time I think it's very clear that you're over-exaggerating what is in reality a non-emergency. Even from the very start of COVID, we knew who was dying, older people with comorbidities. It didn't take a health authority to point that out. The fact was obvious, but still the news media helped by overhyping the few deaths not in this category, and soon everybody felt at risk. And people like you, our unelected health officers, have pushed this false narrative forward, and you've used it to take away the liberties of the people in our county. The facts speak for themselves. Our hospitals are not overwhelmed, and they never were. We've lost approximately 100 people in a county of about 272,000, 70 from nursing homes, and likely many of those were in poor health. You always knew which population might need to take special safety precautions, but you have done your best to scare everyone. Keep in mind, no one under 40 has died in our county. Still, you have the nerve to tell our schools that it's too dangerous to open. Meanwhile, families are struggling to keep kids at home and hold down jobs. You've even admitted on your own school press release that there wasn't a definite evidence base for your recommendations. And that's not a surprise because we know kids are not likely to contract or spread the disease. We know Sweden kept its schools open for kids 15 and under and none of them died. They didn't wear masks either. You, on the other hand, have told kids as young as 3 that they must be in masks by county law and that they can't go to school without one. How can you call yourselves health officers and demand that people cover their faces with their mouths and their noses and not get the oxygen that they need to live and to grow? You hype up your cases when they don't mean anything. The tests are overly sensitive and inaccurate, and many cases are asymptomatic. This isn't a crisis, and you need to stop telling people it is. While you wield power, people are losing their freedom and suffering economic and social harm. Do you know what percentage of people have died in our county? It's 0.035%, which is not an emergency. That is not a reason to frighten everyone from going out on weekends. It's not a reason to force masks on unwilling people. It's not a reason to act as an intimidation force to our businesses and then threaten them if they don't perform your safety precautions perfectly. You've raided our local bars and nightclubs. You've threatened food permits and liquor license. You've talked about calling in the fire marshal. You have people snitching on their neighbors. You have people fearful every time they get within 6 feet of somebody. You're breaking down the social glue of our society. And it appears that you will continue to milk this non-emergency as long as you can, because Dr. Einters has already said that we'll be wearing masks until July 2021. Your health department is overly aggressive and it needs government oversight. Even the county council saw your overreach. You floated the idea of fines for businesses, but the bill you actually sent them included fines for individuals. You added the requirement of a doctor's note, which was against the ADA. Fortunately, you were pressured by citizens to take out individuals from the bill. Still, the fine ordinance is outrageous and needs to be done away with. It has no end date, no OSHA exemptions, no exemption for the deaf and hard of hearing. It has warrant powers.
Thank you, Mrs. Drake. That's the 3-minute mark. Next is Alexandra and Justin Grove. You have 3 minutes.
Sorry, we'd like to speak separately, not together. It's 2 separate people.
Please proceed.
Separately, yes?
Yes.
Okay, thank you so much. So Alexandra Grove from South Bend. There's some good in this world, Mr. Frodo, and it's worth fighting for. What is that good that Samwise Gamgee is referencing? Is it staying in your home away from the hugs of your grandchildren? Is it being told as an 8-year-old that you can't play tag because it might spread germs? Is it eating lunch alone in a plexiglass box? Is it having a Zoom graduation instead of throwing your graduation cap into the air with your fellow scholars? Is it being unemployed without a job? Is it a mother's smile covered up as she holds her newborn in her arms for the first time? Is it missing the burial of a friend who died from cancer? What is the good that we are still fighting for after half a year? What is the good that you, as all sentient and all-powerful beings, demand that we still fight for? Is it 0 deaths? Even I, who hold no medical degree, know that's impossible. Death is just another path, and it's one that we all must take. Whether by COVID-19 or heart disease or cancer or car accident or some other respiratory disease, or stroke, or diabetes, or influenza, or suicide, we all die. And the only question that we have to answer is what good we will fight for before death. And that is not something that is taught in medical school. You have no expertise in that. It is a question that can only be answered first by individuals, then families, then businesses, and then the governmental representatives elected by those individuals. You have overstepped your role, and it is time for you to stop demanding and allow us to answer that question for ourselves. What is the good that we want to fight and ultimately die for? And I would ask St. Gianna Molla to pray for us. Before I close, when you canceled your last meeting, my husband had prepared a number of simple statistical questions to ask. After the meeting it was canceled, he emailed those questions to you, the health board, but he has not received an answer for the past month. Tonight he wishes to make additional comments, so he wanted me to ask if you would commit to replying to his email with answers. Thank you.
Thank you. Justin Grove, you have 3 minutes. You're on mute, Mr. Grove.
Could I start my 3 minutes now, ma'am?
Please proceed.
Okay, that wasn't an answer. I'm coming here not to speak out merely, I'm coming here to speak out not merely against the proposed fines for non-compliance with the mask order, but against virtually all of the extreme measures taken in response to this pandemic, which the masks are only a visual symbol of. In order to do this, I'd like to reframe the debate in an appropriate context. The question of whether or not to wear masks for that, or for that matter, any of the precautions that we've taken up to this point, is not fundamentally a positive question, but rather a normative question. That is to say, it is not a question of what is or what will be, but a question of what ought to or what should be. And yet it has been accepted since the writing of Bacon's Novum Organon that science can only answer positive questions. It lacks the capacity and the desire to answer normative ones. That is not to suggest that science cannot inform ethics, or even that doctors should not make ethical suggestions as part of the practice of medicine, but to point out that the ethical suggestions themselves are not scientific conclusions. Therefore, by taking on yourself such unprecedented and extreme normative steps, you have left the area of your expertise and moved into the realm of philosophers, theologians, and priests. That those professionals have ceded to you this ground and that you have taken it for yourselves is completely unacceptable. I don't know that you could call me an expert in ethics, but I do have a bachelor's degree in philosophy from the University of Dallas, and I studied the relationship between ethical formation and epistemic development at Oxford, and I taught morality for 2 years at the high school level. And the problem I see here is that the steps you have taken fail in virtually every ethical system that exists. Given the extreme, clear negative consequences of the steps that have been taken to curb the disease relative to the potential deaths, in order to justify this behavior, you have to maintain the position that failing to keep from doing anything that could potentially result indirectly in the death of another human being is inherently immoral to the point that it is never acceptable. Such a teleological duty is completely impossible. The only other possible justification that I could come up with is that the idea would be that you were trying to create a utopia by means of coercive policy, and that this is somehow a categorical imperative. Again, that position, such that even the smallest amount of death is accepting it is a violation of that utopian goal. This position is also completely impractical. That anyone would hold either of these positions is therefore deeply troubling. But I believe rather that it's more likely that the cause of this is a moral disorder known as scrupulosity, which is akin to compulsive disorder, and it causes people to focus on a single moral principle to the detriment of all others. Therefore, I urge you to consult the relevant moral experts, including those who are in opposition to your policies. Thank you.
Cheers. Thank you, Mr. Grove. Eric Harris.
Okay.
Mr. Harris, hold on just a moment. Somebody has got to go to mute. Ann Hobbs, that's the name that's showing up on my screen. Could you please push mute? Ann Hobbs, thank you. Okay, great. Eric Harris, you are next and you have 3 minutes.
Well, thank you for giving me an opportunity to speak. As you guys all heard, the opposition for the mask mandates is really going to hurt if you not going to fine people for masks. But if you're going to put fines from businesses, especially small businesses, which couldn't really help pay the workers money and try and lay off people. Do you think that is really a good choice for our community in general? I believe that a individual person has the right to choose where they want to go. Let's say a business you can't go in because of the mask. Well, I don't want to go there, so I'll go in a different place so they don't have a mask policy. It's pick and choose. You can't broadly put a label on it, and people can't go anywhere. That don't make any sense. It doesn't hurt. It will hurt the economy, and it will hurt our way of life. I mean, you hear a lot more opposition to it than you do supporting it. I yield my time.
Thank you, Mr. Harris. Next is Maureen Gatz. Maureen?
Hello, yeah, my name is Maureen
Yes.
Gatz. And I'm a former autism therapist and a mother. I've also completed 3 semesters of medical school before leaving in good academic standing to change paths. I've taken the Hippocratic Oath, do no harm. My husband and I were serious about helping with the efforts to flatten the curve of COVID-19 in March. We canceled our St. Patrick's Day movie tickets and had our daughter's 3rd birthday party at home with no guests. We used hand sanitizer frequently when running errands. No one compelled us to do these things. Our friends were careful as well, and they still are. As time went on and the curve seemed to have been flattened, as far as we can tell from the available data, government restrictions on individual liberties have continued. Honestly, I feel we've forgotten what the original purpose of all of this was. The lockdown measures have serious societal repercussions that go beyond their medical purpose. I thought that tragedy like people dying alone in their homes and looting stores due to economic upheaval, like we were seeing in Italy, is what we were trying to prevent here. We seem to be nowhere near this point in our local area, so increased measures like adding fines to the mask mandate seems to me like a clear overreaction and a violation of individual liberties. Masks cover facial expressions, which is damaging to social interactions, and therefore hinders the appropriate social and language development of our children. I fear for the repercussions on an entire generation of mask-wearing, social distancing children. Also, taking measures like adding fines to the mask mandate should be the last thing health officials should be concerned about if you want to protect the most vulnerable among us. People who are confronted by business owners due to the threat of fines will have negative feelings about mask wearing coming out of the experience. You will not see more compliance with fines, you will see more defiance. Also, it seems to me that your time and efforts would be much better spent educating those who are at risk about how to avoid contracting COVID-19 and not just by social distancing, masks, and hand washing. Last week, my husband's grandmother chose to hold our baby with a mask on. She knew that our baby had cold symptoms and that our 2 other children and I were awaiting COVID-19 test results. We respected her individual liberty to take risks as she saw fit during her visit. She wore a mask, but she didn't seem to understand that holding the baby was very likely to expose her to germs. She also insisted on helping with our dishes, saying that she would wash her hands. My husband's grandmother, of course, sees herself as older and wiser than me, but she knows almost nothing about germs and disease transmission. People like her would benefit immensely from more education about how germs spread and the many ways people should protect themselves from germs if they are vulnerable. And they need to hear it from you, because you are the authority that they trust in these matters. You need to educate people so they don't just think that as long as they follow the rules that have been harped upon, masks or distancing plus hand washing, they'll be fine. That way, at-risk individuals may be more likely to protect themselves well, and we may see a decrease in the metrics that matter most, not pure cases, but hospitalizations and deaths. Thank you for your time.
Thank you, Ms. Getz. Next, we have Mike Huffhand. You have 3 minutes.
Can you hear me?
Yes.
Thanks for allowing us to talk. It's great to hear everyone. A lot of good points have been made. I want to talk about a few different subjects. I think one of them is trust on this whole topic. I think I was told that one of the main goals of this fine business was to get people to wear masks, that people were not wearing masks. And I want to just talk about that a little bit, because I feel like there's a reason for that. And the big reason is debate. There's a lot of people, prestigious medical doctors and scientists around the United States and the world that are talking about a whole bunch of different things, and it's a big debate right now. There's no consensus. There's no settled science about this right now. And so I think if you're going to, do a punitive fine on people when there's a gigantic debate, I think that really puts you in a bad light, frankly. And I don't think that's where you want to go. I don't think it serves the public health department one bit. The science out there is dynamic right now. It's changing. I mean, you see it all the time. And I think people in America, we're not sheltered from information. We have a lot of it, actually. We can go out on the internet. We can go wherever and get this information. There's a lot of good science out there that's being given to us about infection fatality rates and herd immunity threshold. And basically what it's saying is that two things. It's basically saying this isn't as dangerous as we thought it was in the beginning. I think we need to admit that. And number two, the herd immunity threshold is a lot lower than we thought. And some real prestigious scientists have came up with this and figured this out. Notably John Ioannidis from Stanford, top epidemiologists in the world. So I think we should really delve into that and figure out where this is. Certainly before we do any punitive, fine business. I think that just makes you look bad, frankly, because I think a lot of people don't want to wear masks because it's so debatable. I mean, Anthony Fauci goes to a Washington Nationals game and doesn't have a mask on. He takes it underneath his chin. So what are we supposed to do with that? I mean, if he really believes it, he would have had his mask on, but he didn't. And so that's the question is, how can we get people to wear a mask? Well, why don't one of the top infectious disease expert in the world, or the United States, wear a mask? Well, he simply didn't, because he didn't believe it either. That's what we came away with. So I think you should scrap the fines completely, or at the very least push it back 30 to 60 days, okay, and let more public comment come out. So, or you're going to just risk damaging your reputation, which we don't want. We need you, and we need you to do the right thing. And there's a lot of great things you can do. So,
okay, Mr. Huffan, thank you. That was your 3 minutes. And now Jamie O'Brien, you have 3 minutes.
Great, thank you. First, I want to thank the health department for giving the public comment time. I noticed that the county council is not doing that since they've gone to broadcasting their meetings. Of a big concern with the ordinance, specifically as it relates toward the end of the ordinance, there's a provision that if someone were to challenge their ticket and go to court and lose, they have to pay the county's attorney fees, which is, in my opinion, just outrageous. The First Amendment goes beyond just speech and religion. It actually specifically points out that we as citizens have the right to petition for redress of grievances, and somehow trying to impose the county's legal fees on a citizen or a business that may believe that the fine was inappropriate strains every fiber of credulity. It seriously damages the reputation of the health department, and in my mind means that you're really not serious about health. You're serious about trying to make examples of people and or perhaps pushing an agenda on businesses that you may not have a liking for. I also think that it would be appropriate for the ordinance to have a sunset date, a deadline where maybe a year from now the ordinance expires. If it's needed, it can be reenacted. Otherwise, it's going to be on the books forever, like some old Indiana laws making it illegal to hitch your horse to a hitching post in some communities that are still on the books. And finally, I think the ordinance absolutely needs to have a religious exemption. There isn't any religious exemption that would apply to me, but as we are well aware, there are many different religious denominations and faiths out there. And first and foremost, I think that religious beliefs should be recognized and respected. So it seems like a tremendous overreach. I realize that the folks on the health department board are not attorneys, but you must have had an attorney draft this because it has all kinds of what I would characterize as sneaky provisions in there. And it's outrageous. It strains every fiber of credulity. And frankly, I think you guys should be ashamed of yourself for putting it forth. That's it. Thank you for your time.
Thank you, Mr. O'Brien. And then finally, Jen Towers. You have 3 minutes.
Thank you. I would like to address mental health issues in the county. I know that we've had increases in depression and anxiety and even suicides, not just in this county, but across the nation. It's one thing that, having attended several of these meetings, it's not something that I hear brought up, is the mental health consequences from this shutdown, masking, the pandemic itself. I personally have had my own anxiety issues, but I see it in people as you drive down the street. I see, because of the things that we have done, people sitting in cars wearing masks all by themselves. I've seen people sitting in cars wearing gloves as they drive down the road. And it is a very scary thought that we're not pushing the education that other people talked about. We're pushing the fear. And that fear is causing a lot of these mental health issues that we really need to be addressing. I was just recently in a store and I was not wearing my mask, and I saw a little girl with her mom, a very little girl, and she smiled and she waved at me, and I almost cried because she was in a store with people who were all wearing masks 6 feet apart from each other, and she only found one friendly face. And so I really hope that the board looks into and addresses the mental health of its county and what it is doing to exacerbate that, or what they can do to help that. Thank you very much.
Thank you. Thank you, Ms. Towers. And that takes us to the end of our public comment. I would again just like to wrap up, and as Mr. O'Brien pointed out, he thanked us for having a public comment section. That is something that we will not abandon, because I believe firmly in democracy and for the sharing of opinions and engaging in civil discourse. If we lose that, then I guess we're really in trouble. So that takes us to item number 9. Our next meeting will be October 21st at 4:30. So same place, same time on a Zoom, and we stand adjourned. Thank you, everyone.
Thanks, David. Nice job.
Yeah, thank you again for having the public comment.
Yep, you're welcome.